Hi students. So today what we'll do is we'll talk about a very important question. Whether you are an undergrad, you are a NEET PG aspirant or a postgraduate, every exam of yours will ask you about the initial resuscitation of a child with diabetic ketoacidosis. So this video is very important for you. Please like this and subscribe this. So what I'll do is, first of all, I'll talk about, if you have a child with diabetes mellitus, and he comes to you and he's comatose, he's having vomiting, he's having pain abdomen. So how do you define diabetic ketoacidosis? So you should know that there are standardized definitions. According to the International Society for Diabetes and Adolescent Diabetes, they say that a patient, to call it as diabetic ketoacidosis, should satisfy all the three criteria. So here is a child with diabetes, and this child has hyperglycemia in the form of that his blood glucose is more than 200 milligrams per deciliter or more than 11 millimoles per liter, and he has metabolic acidosis, which we define as a venous pH less than 7.3, okay, or a bicarb less than 18 millicalorics per liter, and there is ketosis. Now ketosis can be seen in blood or urine. So in the blood, if it's more than 3 millimoles per liter of beta hydroxybutyrate, or on the urine dipstick you can find moderate or large ketones. That's called ketosis. Now when a patient comes to you and you have diagnosed diabetic ketoacidosis, your next step is to classify this. So we classify, and whatever I'm telling you is from standard Nelson's textbook, that you need to classify the diabetic ketoacidosis into mild, moderate or severe. Now it's based on the venous pH and the clinical picture. So if the venous pH, and as you can see here, if you can see that the venous pH is between 7.25 to 7.35, this child is oriented, it's a mild diabetic ketoacidosis. If it's between 7.15 to 7.25, now he has got Kussmaul's respiration, a deep respiration like an acidotic breathing, that's moderate. And if the pH is less than 7.15 and he is comatose or has severe Kussmaul's respiration, that's severe diabetic ketoacidosis. Now how do you manage these children? Now remember, the first R protocol is the most important question. Now this question can definitely come in your OSCEs, it can come as undergraduate OSCEs, postgraduate OSCEs, as a part of NEET PG exam. So the first R is, these children are dehydrated. They have osmotic diuresis. They are losing water. Moreover, they have vomiting. They are losing water. So the first R management is fluid resuscitation, ideally by normal saline. So you give 10 to 20 ml per kg of normal saline. Remember, normal saline will be the fluid of choice, or you can give ringer lactate, insulin, at a dose of 0.05 to 0.1 units per kg per hour. Remember that in mild cases you may give 0.05. However, in moderate to severe diabetic ketoacidosis, do give them 0.1 unit per kg per hour. Now after you have done the fluid resuscitation and you have taken care of the initial dehydration part, now you go to the second hour and onwards management of diabetic ketoacidosis. Now you give him N by 2. So this is 0.45 normal saline. Okay, so ideally give N by 2 or ringer lactate. Now all of you know that insulin causes transcellular shifts of potassium, so this patient will require potassium supplementation as well. And your examiners will also ask you when to add dextrose. So we add dextrose when blood glucose is less than 250 milligrams per deciliter. So when the blood glucose is less than 250, you add dextrose in the fluids, at least 5% dextrose. So remember, this is a very important MCQ and all of you should be aware about the initial resuscitation protocol of diabetic ketoacidosis, how to diagnose it, how to classify it, and how to treat it. And I hope you found this video very useful. Thank you.